So, dear professors, colleagues, ladies and gentlemen, good evening. Welcome to our school's 20th anniversary webinar series on implementation science. So the topic of our webinar is introducing implementation science, linking research and practice for social scientists. So our speaker is Professor Per Nilsen from the Department of Health, Medicine and Caring Science, Linköping University, Sweden. He is also our visiting professor, but unfortunately we can't host him now due to quarantine arrangement, but we do hope that we can see him in person soon. Professor Nilsen is an expert in implementation science for many years, and he is a leader in the field of having recently published a handbook of implementation science. He has successfully established teaching and research programs in this area in his university, and leading several impactful projects on promoting implementation of evidence-based practice and policies in various settings. So his research covers critical implementation issues such as workplace learning, change responses, leadership, and professional culture in healthcare. He has a particular interest in issues covering behavior and practice change, and the use of theories, models, and frameworks for improving our understanding on implementation challenges, and of course, to develop potential implementation strategies. So without further ado, I would like to invite Professor Nilsen to start the lecture. Professor Nilsen, please.
Okay, thank you very much. I think my video is stopped.
You can try sharing your screen now.
Yes. So I wonder if it's this. Do you see the presentation now, or is it?
Yes, this is all right. Yes, I can see it. It's perfect.
Okay. And shouldn't my video be on also? Because I think you have
the start video in the lower left part of your window.
It's just you cannot start your video because the host has stopped it.
Oh, I'll take a look of it.
I can survive without being seen, but maybe it's good. Okay, should I start anyway?
Yeah, you can start right now, but I'm fixing the video thing for you.
Okay, thank you very much. I visited Chinese University of Hong Kong in 2017, and I met Vincent and many of his colleagues, and it was really interesting to be able to discuss implementation science. And it's very pleasing, I think, that it's Vincent and others have kept this research interest going with I think several studies on implementation issues and funding applications, etc. So it's nice to be back, even though it's in a non-physical sense, at least for now. So I will, yes, and maybe something on Linköping University. Linköping University is quite large, and Linköping is the 5th biggest city in Sweden, but it's small compared to Hong Kong. I think Hong Kong has a similar population of the whole of Sweden. But Linköping is known for being, I think it's the highest proportion of higher educated people is higher than in any other Swedish city. So it's a very sort of, okay. And yeah, here it is. And I put up some Swedish persons and innovations, although I know Volvo these days is actually owned by, at least the majority, by a Chinese company. But I guess these others, IKEA is well known, etc. And Spotify was a Swedish innovation. So I think Sweden is a very sort of technically oriented country, is quite high. So anyway, what I will be talking about is first some sort of basic understanding what implementation is and what is the study of it, as we call it, implementation science or implementation research, and something on its history, and then focusing quite a bit more on using theory, and ending with some of the challenges I think we are facing, and researchers and practitioners involved in implementation. And most of the content of this lecture is covered in this book, which I think Chinese University of Hong Kong has a library. Students are able to access the book. And I think if there are questions on that, I think Vincent can get back on that after the session. Because I think that's important that to have library access, because the book has turned out to be extremely expensive, because that's apparently Elgar Publishing's policy. We didn't really recognize that. We thought it would be averagely priced and reach many people, students that way, but I think it's in an ebook that's been more spread. So what is implementation then? If we look at the origins of the word, we can get some sense of the meaning. Fill or fill up, complete, and that seems to be the, I call it sort of old school understanding of implementation as something that is a separate stage, sort of at the end, and then something. Up-to-date view is that implementation is a process, and there are many phases, and it's actually difficult to say when it is implemented. And we also talk about sustainability, that the implementation has to be sustained. And we use all these different words with a similar meaning. Although I think my impression is that the implementation has become quite popular word amongst politicians and business people, that you implement something. This is not new. Implementation has always existed, if you view it in terms of translating ambitions into reality. So implementation is not new, but the study of it is a relatively recent phenomenon. And when people ask me how to define or what is implementation and implementation research, I usually view it as a link between knowledge, research, evidence, or ambitions, policies, and the benefits for patients and populations. We need this sort of, not the missing link, but the link. And that can be healthcare, but it can also be in the community. And if you do policy research, it could be government authorities at different levels who sort of execute an attempt to implement the policies. So this is one way to look at it. And we are used to doing research here on patient health and population health and cancer studies and lifestyle injury prevention. But there's an increasing recognition that the results we get here also depend greatly on what is done here. So that is an increasing recognition, and implementation science, as I will show, is a very much expanding field. And here is a more up-to-date case, actually real-time case on the COVID. If we have the research producing vaccine, we need healthcare to deliver that, to achieve the patient and the population benefits. So this is a good example of the importance of also examining the dissemination and delivery of the vaccine. And there's a lot of statistics on that, and I usually check that to see how it's going. I think it's quite interesting is that it seems many countries quite relatively quickly reach a sort of 70–80% vaccination rate, but the final part of a curve, it seems to be the very tough challenge. It's the same in Sweden as in many other countries. Okay, and then to further distinguish implementation research from what we might then call clinical research, I think this paper did a good job, because we are used to doing research on various sorts of in implementation research. We're interested in the uptake or use of these innovations or interventions. And what we implement then are some examples here. Usually it would be evidence-based interventions or practices. And that's why the focus here is, if we assume that this clinical innovation is an evidence-based practice, our focus is not on evaluating the effectiveness. It is sort of assumed that what we implement has proven to be effective. So the remaining issue is the extent to which it is used, and also if it's used with high quality, etc. For example, motivational interviewing. There is research on the sort of fidelity to the techniques involved. And another paper, which I think gives a good indication that implementation research has its challenges, because if clinical research focuses on patient outcomes, patient health or population health, that is a somewhat more narrow focus than implementation has, because here we have to investigate the providers, healthcare providers, the organization, there's working in teams, the culture and policy level. So it's a very clearly benefits from a multi-professional and multidisciplinary approach. It makes it a bit challenging, and it makes it, I would say, more social science than medical science, because social science, we accept that there are different factors and different levels which interact. And defining implementation science then, and this is from the first issue of the leading journal in the field, Implementation Science, and actually asked Brian Mittman why they decided that it should be called implementation science, because that was a term that hadn't been used, because we did talk about implementation research. And he said it was to give it a more sort of serious sounding and maybe more medically oriented vibe, even though I think we talk as much about implementation research as we do implementation science. But anyway, the term has stuck, and this journal has grown considerably over time. It's 15 years old, so it shows that it's a relatively young field. And the definition, I think, is important for a number of reasons. One is the emphasis on that we study methods, or we would usually call that today strategies, to facilitate or promote or support the uptake of research. So the implication, or rather the assumption, is that nothing will be implemented unless we use strategies. So it's a sort of a realization that evidence by itself is not sufficient to spread practices. It's usually some sort of strategy that needs to go with the practice. And another point is that here the emphasis was on evidence-based practices. I think as the field has developed, evolved, we also look at practices where it's more contentious to say that it's evidence-based. It might be one study, a pilot study, but you could say that it is a promising intervention or practice, which is also studied in implementation science. So I think this definition actually needs some up-to-date tweaking to be really reflective of the studies that we do in implementation studies, in implementation science. And we talk a lot about this knowing-doing gap, sort of a cliche, I think, and this is sort of the cliched point of view that academia excuse me, produces knowledge and research which practitioners do not take up, do not implement. And I think if there is a gap, and there is a gap, it is also due to how research is conducted, because if you do RCTs under strictly controlled circumstances, even though you show good effects, it might not be easy to implement this intervention, for example. So I think what we need more is sort of practice-based evidence, studies more resembling how practice is carried out, because so research has also to sort of getting closer to practice, and practice has to keep up with evidence. But I think we have also have to recognize the challenges. People have habits, there's a culture. Changing practice, change overall is often challenging. So I think the field started out probably quite optimistic that, of course, evidence will spread and we will use strategies. But I think over time, there's a recognition that achieving practice change is often difficult. So this gap, I think, is both due to how research is carried out, and also due to practice not keeping up to the extent that is possible. So implementation science emerged in the wake of an evidence-based movement, and the evidence-based movement, EBM, sort of popularized the notion that scientific findings should be more comprehensively used in routine practice. It put the emphasis on the use of research findings. It's not as if research wasn't used before. So it's as it might seem, but the novelty aspect is very much the focus or emphasis on using scientific findings. And I think maybe this is an exaggeration that people naively assume that, but I think I often hear researchers also not involved in implementation research, but maybe intervention research, if they get really good results in their trials, there is a sort of optimism that this will spread because it showed so good results. I think it's more, it takes more than that. Evidence is sort of one part of a multifactorial equation. And yes, I think this is quite nice for anybody involved in implementation research, that it's very much a growing field. I looked at PubMed, which publishes, I guess, mostly medical literature, to see papers using the term implementation science in the abstract or title. And it's almost an exponential curve. And there was no mention of implementation science before 2006 when the journal started. So the journal clearly came up with a new term. And yeah, it's been interesting to see this incredible growth. I think I started doing research around 2010 on implementation. And my previous research was on alcohol prevention, for example, and other lifestyle areas where there really is evidence for various interventions. So I think doing implementation research is often sort of a natural extension of doing intervention research. Because if there is evidence for the effectiveness, you might not need to do study number 98 after 97 existing, and it might be more relevant to focus on implementation studies. And I've actually checked some other fields, and I haven't seen any other field with this growth, although I'm quite sure that artificial intelligence, for example, will probably beat this curve. So it's a nice development, and it's also been a bit tougher to get published the more papers are produced, but there are new journals coming, so I think there's a lot of opportunities to get published. And also we have this, if you do a study on implementation of cancer pathways or whatever, they're all pertaining to the specific field. So I think there are many outlets for implementation studies. And there are many different terms for what I think is essentially the same type of research. Knowledge translation is a more common term in Canada, for example. But it's essentially the same. So I don't think there's much point in trying to spend too much time and effort on trying to differentiate some nuances. I think it's better to talk about implementation research, actually. And I think maybe we should go for a short break if any questions, because the next section will be, I will focusing on how we use theories in implementation science. So are there any questions on this sort of introduction to the field? Or should we take a 5-minute break?
So hello and welcome back, everyone. This is the second part of the webinar Implementation Science, and we have Professor Per Nilsen with us from Linköping University in Sweden. So please, Professor Nilsen.
And you can see this slide now?
Yes, thank you.
Okay, so the next section will be about how we use theory in implementation science. There was actually a discussion early on in the field, 2005-06, as to the value of using theory. Some actually felt that we should rely more on common sense. There's nothing wrong with common sense, but I think theory makes more is about explicit assumptions. Since then, there's been a strong advocacy for using theory, and the question is often which theories are most applicable. What is relevant? Should we use psychological theories, which is more individually focused? To what extent are we using organizational theory, etc., etc.? So there's been a tremendous focus on theory in the field. So why are theories so important? And I think this does not only apply to implementation science, of course. Well, if we recognize that the implementation research is about implementing change, almost, yeah, behavior change, practice change, some sort of change, then it would be like black box studies if we didn't attempt to clarify the causal mechanism. And they're also called core components, active ingredients, etc. And that is essentially the same as saying that we need to try to understand the how and why certain changes or outcomes were achieved or not. And we cannot do that if we don't use theories or explicit assumptions of how it was intended to work. We are essentially guessing. And understanding why some outcome was achieved makes it possible to develop improved strategies and improve implementation. So I think we have a strong case for using theory. And that's not only for implementation science, of course. So comparing the use of theory with sort of basing findings or interpretations on experience, common sense, etc. One are open to question and examination. If we use our beliefs and assumptions, well, we can be right, but they can be also more difficult to challenge. Theories can be adapted or abandoned, and that maybe not so often abandoned in implementation science, but there are some clear cases of theories being adapted over time as more experience is gained, I'd say. Also, theories give the individual facts a meaningful context, and you can contribute to building a body of knowledge. Common sense might be more producing more isolated facts. And this is a common or well-known saying by Kurt Lewin, and that's all good, but the question is, which should we choose? And I think the field is at a stage where this is more increasingly discussed. And different guides actually to how you select theories. And yeah, the backdrop here is that this is not always done. And I see that in our PhD level course that people simply choose something without too much consideration of its relevance or applicability. It's some even say that I was recommended by my supervisor or whatever, but I think that's not good enough. We have to be able to motivate why we select certain theories or even use parts of them. And CEFIR here, Consolidated Framework for Implementation Research, is one of the most, if not the most commonly used framework in implementation science. It was similar case with Paris, which is also very popular. So I call that off-the-shelfism, that just because there are so many theories, models, and frameworks to choose, it makes it quite easy. You can pick some, but the question is it really appropriate for your study? Because not all theories are the same. And yeah, that's one reason why I did this paper, which is my, by far, I think it's probably more, yeah, put together or something. But anyway, it clearly fulfilled a need. It's an attempt to structure these theories, models, and frameworks in the field. I don't think it's rocket science. I think it's a case of trying to structure theories, models, and frameworks pretty much based on questions we got in the first years we ran our course, because students were confused about the terms, models, and frameworks, and how do you distinguish a theory from a framework, etc., because these terms are used quite inconsistently. So the following presentation is pretty much based on that paper. And if you look at implementation, imply some sort of predictive capacity, and very much key is that they feature causal mechanism, that A influences B and B might influence C and D, which might impact on the outcome. And this is not the case with models. And models are the more how-to guide. They describe and or guide the process of implementing new practices, innovations. So they are more concerned with the implementation practice, the how to implement. Frameworks are, I would say, more similar to theories, but instead of presenting causal mechanism, they sort of say that these factors are determinants of an outcome. So it's sort of compressed theories, actually, because theorists might see this as a chain of causal mechanism, whereas frameworks only say that these factors influence an outcome. So models and frameworks do not specify the mechanisms of change. You could view them in terms of being checklists almost. And a tricky thing here, which is quite confusing, is that some models are called frameworks and some frameworks are labeled models, etc. So instead of only looking at the title or label, we need to look at what they are intending to achieve. What's their purpose? So it was quite possible to distinguish 3 different purposes. And the first is this, which you could call implementation practice. You have models which can help facilitate this process and describe it. Then you have the research aim of understanding, explaining how do we get these outcomes. And then evaluation, it needs to be said that you can also use frameworks here and connect them with the evaluation, and the same here. But there are a few frameworks which are explicitly focused on evaluation only. So I call these process models, and they are sort of the how to implement. And I'll give you some examples. I think it is probably more clarifying. This is quite popular in our course, because in our course people come with their own implementation case. Usually what they do research on might be their PhD work. And it might also be that they are practitioners and sort of split time between being a practitioner, clinician, and doing research. And I think many find that this process model has many advantages because it's based on 25 studies. Maybe that's not so much, but I think some of these studies were based on further number of studies. And it identified a number of activities which have been shown to be important to successful implementation. So I usually suggest this if you are doing an implementation project, because you can almost use it as a checklist. Have you created an implementation team, etc., etc.? Noteworthy here is the amount of work, phase 1 and 2, done before implementation actually starts. I think that's a key lesson here, and I think it goes against how it quite often is done. That is sort of a decision, and implementation starts a bit abruptly. So I think the key lesson here is how much you have to prepare before even starting the implementation to succeed. So I think that this is a good example of a process model. And this is quite similar, even though I think it's a bit more overarching, less wanting to find out about something, and health issue, and doing maybe knowledge synthesis, scoping reviews or whatever, and then starting this action cycle. And it's actually has one of the steps is sort of the focus of the next category, determinant frameworks, because they are focused on categorizing and identifying barriers and facilitators. So I think this is an extremely important step, but here it is sort of one step amongst many, which might be, give the impression of this being something you do fairly easy. I think this is a whole sort of research topic in itself. So I think this is less useful than this. And then we go on to these more frameworks, which have frameworks and theories, which have the aim of understanding, explaining what influences implementation outcomes. Determinant frameworks, of which there are many, and I separated these from theories. Classic theories was my name for those developed in other fields, from psychology, for example, and implementation theories were the corresponding theories developed within implementation science. So I'll give you some examples here too. Determinant framework, one of the, I think, most widely used, developed by Susan Mickey and colleagues, psychologists. So this framework says that these 14 domains, I think it's 14, are influence behavior change or practice change. What is required for successful implementation. And I think it's noteworthy that the focus is very much on sort of individual level determinants, optimism, skills, knowledge, your intentions. So it's clearly from a psychological point of view, it does cover also social factors, environmental context and social influences, your professional role. But I think 11 out of 14 focus on individual level factors. And then, which I think is the most widely used, so a paper from 2007 argued that this was the most commonly used. And if you compare to the previous one, it has more focus on, for example, outer settings. So these are the corresponding with the 14 domains of the previous one. This says that process, inner setting, outer setting, and the intervention are the determinants. So this has a broader approach. So it's clearly, I mean, it depends on what is being implemented. Is it something that individuals have a great deal of autonomy and independence about determining if they want to use it or not? Or if it's more sort of a policy or something that everybody is expected to do, then this might be more relevant. And here is an even more overarching determinant framework, which simply says that successful implementation depends on the evidence, the context in which implementation occurs, and then the facilitation, which is the same as strategies, or the original definition talks about methods, something that supports the implementation. And this has been developed into I-Paris, which is for integrated Paris, because it's noteworthy that this lacks the healthcare practitioners or providers. So they've added that because they recognized that this didn't really cover all the important determinants. So that's an example of how adaptation can occur over time. So these were 3 determinant frameworks pointing to X number of determinants which influence implementation outcomes. And this is my attempt at a synthesis of a number of similar determinant frameworks. We use this in our course because when people come with their study cases, it's often very good that they have to describe what is it that is being implemented, and it's a practice rather than something concrete. But we call it the implementation object. Are there any strategies used to support the implementation? Who are the adopters? And also sometimes we have patients as a specific category. Some include patients in the context, and the context is a real challenge to be able to describe and study properly. So I think this pyramid is good because it provides a structure, it simplifies, it makes your study case more concrete. And classic theories, this is one of the most widely used psychological theories, and here's another from psychology. They are also used in implementation science, even though I think they are much more widely used in health intervention research and health behavior change, etc. But it's sort of assumed that the similar or same factors are at play also if the behavior is the provider's behavior, for example, using an evidence-based practice, even though it would usually be a behavior like physical activity or smoking. So many of the theories which have been used for health interventions have actually been lifted over and used in implementation science. And I've never seen a discussion on how relevant that is, but I think that's maybe something that could be somewhat debatable, because I think, a work environment is with colleagues and a manager's culture might differ quite a bit from the circumstances of a health behavior. But that's another issue. And then implementation theories, there has been quite a few developed in the field by researchers in the field. And this is one example, also by Mickey et al. And this is also, it's somewhat similar to the theoretical domains framework, which was a determinant framework, but this is a theory because it proposes a number of causal mechanisms. Actually, I first interpreted this as another determinant framework because it seems like we have 3 domains, or I think they call it systems, being able to do the behavior, being willing, motivated, and having the opportunities. But when I did that paper, 2015 paper, Susie Mickey was one of the editors, and she rightly pointed out that this was actually theory because they have these assumptions of the causal mechanism. So this I'd consider an implementation theory. And if you come to evaluation frameworks, it should be added that, I mean, you can use this for evaluation purposes. You can use all of these to evaluate, but then there are a few specifically developed for evaluation purposes, like re-aim, which I think is a good public health framework because it extends more. I mean, it addresses not only the effectiveness of an intervention, but also how many it reaches. So this has also been used in implementation studies. So we have these 3 purposes, and based on that, you can identify 5 categories of theories, models, and frameworks. And here are what I think we should call models. And frameworks, classic theories, implementation theories are used for research purposes. And of course, these can also be, but these also provide the practical guidance. And then evaluation frameworks. So I think this framework, or maybe it's called should be called a model, since it's a simplification, might be helpful in thinking in terms of what is needed for my project. And a few more words on theories. There is always a theory, even though we don't have it in words on paper, or it's not been published. But we do have informal theories, sort of speculations, but you could call it theories because we assume various things. And what I've presented, you can call formal theories. And I am a strong advocate of using logic models and program theories because they make informal theories explicit. And it's the explicitness that is the key. And I think it's not always the case. A complex intervention which will be implemented, it's not always obvious what is the appropriate theory, model, or framework from the various versions I've presented. It might be it might be more relevant to develop a program theory for this specific implementation. I also think program theories are very good if we co-create strategies and interventions, because you can communicate concerning the assumptions. Are we agreeing that the results will be achieved through this causal mechanism? And here are some examples of how they could look. Usually start with the inputs, the sort of conditions. Outputs, there's more shorter term, and impact, the more longer term or profound results. So I think, but the key is making assumptions explicit, whether we use formal existing theories, models, or frameworks, or program theory. And since research is about transparency, is a key feature of good research, I think it really is aligned with using program theory. And I think there's some time for addressing some of the challenges, and I think it seems like we are more sort of influenced by psychology, and I think the context and collective level, the culture, we have not really addressed that to the same extent, and probably many reasons, one being probably more difficult to measure. And this is a field where measurement is highly valued. Leadership is another sort of collective level, or less to do with the individual's attitudes. I mean, leadership influences many people, so I think that's also really important and probably under-researched at the moment. Yeah, and I think it is social science, but we have these ideals of doing RCTs and reductionism. By that I mean that we look at one determinant at a time, even though two seemingly unimportant determinants might combine to be a very strong, important determinant. So we cannot look at things, influences in isolation of each other's. Yeah, we recognize that the problem might be complex. So then our solutions or strategies, are they sufficiently complex to address this? And this field is very much focused on either say that if we remove these barriers, are they facilitators or enablers? I mean, because resources and time are common barriers, but will more time and more resources always lead to improved implementation? So I think that's a challenge. And I think I touched on this, that you can get results with lots of resources and training, but I think it's important to do studies under as realistic conditions as possible. And I think I've been involved in a few ethnographic studies where we study what people actually do rather than say they do. I think that's quite an interesting approach. And yes, this is an issue. When does implementation end? And we also need to really investigate using theories, models, and frameworks. In what ways does that influence the chances of successful implementations? I think we need studies to demonstrate their utility. And this is very often talked about these days, I think, co-creation and co-production. We did one study that showed that it is difficult, also different times, perspectives, practitioners, researchers. Yeah, and if researchers knew about what was that there was evidence for certain strategies, but the practitioners argued for other strategies, how do you sort of align that? And I think finally, it's sort of a paradox. This whole field is based on implementing knowledge, but are we implementing the knowledge from this field? And I think quality improvement science, or quality improvement, probably better at making use of the tools and knowledge generated in that field. So I think that's it. And then I'd be happy to discuss further questions.
Thank you very much for your excellent presentation. And now we probably have a clearer picture on how to use the theories, models, and frameworks to frame our implementation science studies. And let's see if we have any questions. So if you have any questions, you may want to type in the Q&A box, and we will try to adjust them. So we got one questions now here. One audience is asking, if we are doing an implementation study of a health policy, should we just assume that the policy is effective, or we're gonna ignore the effectiveness evaluation of the policy and focus on the implementation procedure, or there are other options? And she wants to know how we should proceed evaluating this. I think she may need a hybrid design, isn't it, Per?
Yeah, I mean, this is a good question, because it's been stated that we should sort of assume that evidence is sufficient and we should focus on the uptake. But I think many policies, I mean, you could say that they're knowledge-based, they're based on some sort of knowledge, but I don't think there is always that overwhelming evidence. So I think we should also look at the extent to which, I mean, stakeholders' perception of the evidence for this policy. Because, for example, in the pandemic, we have had all these social distancing policies. And of course, some would say there is evidence for these, but others scrutinize and are critical. So I think in real life, evidence is often contested. So I think, I mean, for mouth facial protection, I mean, it's been this ongoing debate in Sweden. So I think the pandemic has been a really case study of the challenges with evidence. So I would say that do not take that for granted that there is evidence, but account for that in the study, if possible.
So from an evidence-based healthcare perspective, I think for people who are healthcare professionals like myself, or people having an evidence-based medicine background, we assume that your policy is substantiated with evidence from either RCT or well-conducted meta-analysis, and preferably this is also included in the guideline as well, because in the definition of evidence-based healthcare, we try to integrate evidence with expertise as well as patient preferences or public values. So in the guideline development process, we will take into account the experts and the patient's perspectives as well. So in that sense, if it is being included in the guideline, we sort of have a consensus, yes, this is pretty good, and we like that. All the case stakeholders basically come up with a consensus that we should do it, okay, or not doing something for the implementation. So when you're doing an implementation studies, you can then actually move on from a guideline because we have a consensus already, we want to do it, and then you can focus on the implementation aspects of the policy or particular intervention. Okay, so we got another question from Sylvia. So she's asking, which framework or theory do you recommend for evaluating the influencing factor of implementing clinical practice guideline? And what is the reason for choosing that particular framework or theory?
Yeah, that's also a good question. I think SEPHIR consolidated framework for implementation research is probably the broadest there is. I'm not sure it's perfect, but it seems to be the broadest. I think theoretical domains framework also has its advantages, but it sort of assumes that the individual has the autonomy to decide whether to use this guideline or not, and that might be relevant. I often suggest that one should look what has been used before, how, if, and then how they have motivated the framework. But I think TDF or SEPHIR are the most widely used and the most robust, I would say, actually. I mean, Vincent, didn't we use Zephyr in one project, and I think it's sort of quite applicable to various topics, actually.
Yes, yes. Unless you have a very specific behavioral thing you want to address, probably Zephyr is the most comprehensive framework where you can actually assess a wide range of different factors, both from within and outside of the organization, as well as even within the organization, many levels of different determinants is being included in CFIR. For theoretical domain frameworks, I think the main advantage is that, as you mentioned before, you have the autonomy to do certain things, and you want to change a very specific behavior, then probably TDF is more useful. So it depends on the perspective you want to focusing on. So is there any additional questions from the audience? If not, oh yes, there's another question. Okay, so so this audience mentioned that her research focus include the use of psychological theories in the study design, but she found that the theory did have some limitation. You just mentioned that implementation study is guided by certain theories or model. How do you deal with the initial limitations of different models or theory? Is it possible to improve the theory through implementation study? I think there are two questions here. Number one is you may want to actually look at which theory or which model is more applicable, because you first have to understand what the limitations are for each of the models or framework. And secondly, actually, how will we actually make the models or theories even more sophisticated through empirical study?
Yeah, and I agree. I think we often find that if you sort of, I mean, we are sort of advised to be deductive, to use something existing, but this something existing might not be optimal. We discover aspects which it is missing, and I think we usually, I think that we report that, because in the discussion you sort of relate, you sort of discuss the usability or the utility of the theory you used, and if you did discover aspects not covered, I think that's very important. But I agree. I mean, it's difficult to review hundreds of theories and come up with something optimal. So we usually choose something that's been widely used, but still it can have its shortcomings. So I think, I mean, addressing that, because that's also when I talk about knowledge accumulation, that we can improve theories, models, and frameworks over time. I didn't really understand, is it possible to improve the theory through implementation study? What? I'm not sure if I got that question. Can you clarify that, Vincent?
So the question is, she's asking if it is possible to improve a theory through empirical study. So maybe probably you want to test a certain theory through a case study, and you accumulate experience, so you modify a particular theory. I think she's asking whether this is possible or not.
Yeah, I mean, that's definitely possible. I think when we apply a theory, model, framework, I mean, we use it for our own study, but we also sort of at the same time testing that. Does our empirical data, is it covered sufficiently by this? Because I think I usually have a picture where a theory is one piece of a larger cake, and the larger cake is sort of the real world, or a large phenomenon, and a theory will always be sort of looking at a part of that. So I think, I mean, we learn as we go along. I've learned I didn't really address things like culture or leadership. It's been sort of experience from doing research, and then I'm looking for how we can address that. So definitely you can change, evolve over time. And I think this, I mean, I'm an advocate of using theories, but I also think it can be limitations. And it's a bit like we're forced to using that, but yeah, we have to also be sort of skeptical and see, did it really cover everything?
So follow up on that, I have a question actually. So you mentioned that actually you're trying to use program theories or logic model instead of theories in guiding implementation studies. So from your experience, will that be more convenient to use an off-the-shelf theory, or you actually think through the issue and use data to construct your own logic model to answer the research question? Which one is your preferred way of doing implementation research, and what are the relative pros and cons of the two approaches?
Yeah. I think using a program theory as a first step in a group or discussing with stakeholders, that might lead to identifying something existing, because I still think that is sort of what we are expected to do. We did, for example, did a study on de-implementation, what influences de-implementation, and we felt, well, that is different from implementation. So let's do this inductively and see what categories could we find. And we often end up with sort of socio-ecological, it's the organization, it's society, etc. And that was rejected because we should have used an existing framework. So that learned me the lesson that it's almost like we are forced. But I think, yeah, I mean, program theories, when you develop the projects and when you sort of, maybe more as a first step, I'm not sure how many studies use them, because then you could get this critique, this resembles this theory, you should have used that, because there is some sort of gatekeeping system in research, and some of the editors at journals have sort of their own interest in various theories. So I think it's good that we have more journals now, because it makes it more possible to expand and not be so like everybody else is doing or what is expected. A bit more freedom on how you, I mean, to develop the field more, because I think a field which is so young, it shouldn't stop with X number of theories, models, and frameworks. It should be open for more influences, I think.
Okay, so we got another question. It's a follow-up question. So how can we actually make a methodological decision to evaluate the policies, a certain policy effectiveness element into implementation research? So unlike clinical intervention, a health policy may not go through a complete scientific process of evaluation, through a pilot study or an RCT, or they may not even have a program theory to support it. So how should we deal with this implementation challenge?
I think that's where qualitative research is needed. Because I think, even though we like to think of evidence as something objective and measurable in RCTs, I think what it comes down to, and I think that was so evident in the pandemic, is people's subjective point of view or interpretation of this evidence. Evidence is, you can interpret the same evidence slightly different. And we saw that with facial masks, social distancing. Denmark had much more lockdowns than Sweden. Sweden was more open. The discussion, what is there really evidence for? And evidence, if you look wider, I mean, societal impact, etc. So I think qualitative and quantitative mixed methods, we can learn a lot from using both. And I mean, policy effectiveness, I agree, that would be difficult to objectively measure.
So from an EBM perspective, so if it is not a clinical intervention, it is a policy, something like, okay, we want to enforce the use of masks in public places. So obviously this is an emergency. So people just promote this or implement this policy without rigorous RCT evaluating value of face masks. So since we have to implement it, then the implementation process represent an opportunity for evaluation. You can do a PM post study, you can do a case control study to actually look at the effectiveness of that particular policy intervention. And at the same time, you look at the implementation process. So I don't think they necessarily, co-conflict with each other. They can be done simultaneously, where you evaluate effectiveness and implementation at the same time. I think this is what we call the hybrid design in implementation research, where you look at both effectiveness and implementation outcomes simultaneously.
Yeah, I totally agree. And I think there are many examples of natural experiments, because if it was implemented in one region and not in another, you can. So, I mean, there are opportunities, but I think, I agree. There are many interesting, and I think, didn't the economic Nobel Prize winners, they talked about natural experiments where you sort of you can compare real life, and I think that's what I talked about, being studies conducted under this sort of real circumstances.
Okay, so this is probably the last question. It is now 8:30 in Hong Kong. So per which step of an implementation research, investigating facilitators and barriers of implementing a particular policy or intervention, do you think is the most difficult or controversial? And do you have any advice to avoid possible traps when you're trying to conduct this part of the study?
I think identifying barriers and potential facilitators is relatively straightforward. But I would take that as an example where I think qualitative research is important, because if you do that quantitatively, you have to decide beforehand which are the potential barriers and get them to rate them importance or whatever. But I don't think, but I think the challenge is linking knowledge about these barriers to the strategies, because that's, I mean, well, what is, sometimes it's really good where knowledge might be lacking, then you can, knowledge is a good strategy, but not always. So I think that's still the most, maybe not controversial, but most difficult.
True. Yeah. I do agree. So thank you very much for all of you to come to this webinar, and we have a very full discussion as well with many different questions for Professor Nilsen. So I'm sure that this is now a very popular topic here in Hong Kong and in China as well. So we're looking forward to our forthcoming visits from Professor Per Nilsen, so he can deliver even more expertise and experience to our audience here in Hong Kong later on. Okay, so I will pass the time to Nanny.
Yeah, thank you, Professor Nilsen. Professor Chung, we are looking forward to seeing Professor Nilsen here in Hong Kong next year, probably. And thank you everyone for being here. And this is the evaluation time. I'll show you the evaluation form here. Yep. So for doctors who are going to claim CME points, you are required by the Academy of Medicine to fill in the evaluation form. And for others, we are very happy to have your opinions and have better events next time. And we are going to host so many upcoming events, including webinars and other workshops. So if you want to stay tuned with the school, please go to our school website and social media like Facebook and LinkedIn here. And we hope to see you again in the near future. Thank you very much. And I think, yeah,
Bye-bye.
up here. Thank you.
Thank you. Bye-bye.
Thank you.